Good day, I am Mary Francesca Tan, currently a student and junior clinician in Cebu Doctors University, and I am here to discuss our research entitled In Vitro Comparison of Fuji and Granny Smith Apple Extract on Tooth Whitening. Tooth discoloration is a multi-factor condition that significantly impacts patients' self-esteem and overall quality of life. Studies have shown that coffee consumption has led to persistent enamel stains caused by malic acid binding to the enamel, causing discoloration. By comparing these extracts, Fuji apple and Granny Smith apple extract against the standard 16% carbamide peroxide control, this study hypothesizes that the malic acid-rich Granny Smith extract would show a whitening effect, emphasizing the potential of specific malic acid concentrations in cosmetic dental application as a natural whitening solution for coffee-stained teeth. This study aims to determine the whitening effect of Fuji apple extract and Granny Smith apple extract in whitening coffee-stained extracted human premolars. Having the Fuji apple extract and the Granny Smith apple extract as our experimental group, distilled water as our negative control group, and 16% carbamide peroxide as our positive control group, finding any significant difference in the tooth shade of our coffee-stained extracted human premolars before and after immersion of the coffee and its treatment. Once 40 human extracted premolars was obtained by the researchers, following our inclusion and exclusion criteria, a true experimental method of research, specifically the pre-test post-test complete randomized method, was used in the study to determine the whitening effect of the extracts on the coffee-induced extrinsic stains in the extracted human premolars. Thus, a single blind approach was used to minimize bias when evaluating the whitening effect, using a Vitapan classical tooth shade guide to further assess the tooth color changes before and after applying the apple extract treatment, using CDU's school facilities being the experimental research laboratory and an area adjacent to the mirror hall of CDU. Transmittal letters were sent to the Dean of the College of Dentistry requesting for the approval to conduct the experiment as a requirement for completing this course, to the College of Optometry to undergo a 2020 vision acuity test and a color vision test. This will help in the selection of the 4 qualified researchers to determine the change in tooth discoloration. The initial shade of each tooth sample was assessed by using the Vitapan Classical Tooth Shade Guide by the 4 qualified researchers without color vision deficiency under the supervision of a licensed professional dentist before tooth staining procedure. In handling the tooth specimen, a cotton plier was used to prevent cross-contamination. To achieve uniform discoloration, each sample was immersed in a prepared coffee solution consisting of 10 grams of coffee powder to be dissolved in 100 ml of 37 Celsius water, while the apple extracts was obtained through a juicing process. The results were summarized as the median of the tooth shade of the premolar score before immersion in the coffee and after immersion of the treatment groups. Following the treatment application, the difference in the whitening effectiveness were observed among the 4 groups. Premolars treated with green apple extract and 16% carbamide peroxide both demonstrated higher medium tooth shades around A3, indicating improved whitening effects. In contrast, the premolars treated with Fuji apple extract exhibiting the lowest median tooth shade around A4, suggesting minimal whitening effects. The distilled water group showed intermediate results. These findings indicate that the green apple extract and the 16% carbamide peroxide effectively improved the tooth shade, whereas the Fuji apple extract and the distilled water did not produce significant whitening effects. Comparing the table shown here on the extracted human premolars before and after immersion of the coffee and its treatments, significant change can be seen from the green apple extract and the 16% carbamide peroxide, as its shade has been noticeably whitened compared to the before treatment immersion. The Kruskal-Wallis test showed a significant difference in the tooth shade outcome among the 4 treatment groups. Post-hoc Dunn's test revealed that the Fuji apple extract group differed significantly from all the other groups, consistently demonstrating poorer whitening performance. No significant difference were found between the green apple extract and the 16% carbamide peroxide, indicating comparable whitening efficacy between the 2 treatments. The findings suggest that the green apple extract demonstrate a greater whitening potential than the Fuji apple extract, and its effects appear to be comparable, although not equivalent to that of the 16% carbamide peroxide. However, the clinical relevance, safety, and long-term effects of the green apple extract on enamel integrity require further investigation. Future studies incorporating enamel microhardness testing, surface roughness analysis, and in vivo trials are recommended to substantiate these findings and determine the feasibility of green apple extract as a natural tooth whitening alternative. Overall, the results demonstrate that the green apple extract exhibits a whitening effect comparable to the 16% carbamide peroxide, while Fuji apple extract shows minimal to no whitening capability. These findings suggest that the green apple extract may serve as a potential natural alternative for tooth whitening, whereas Fuji apple extract does not produce clinical significant whitening effects under the conditions of this study. Clinical implications for the patients, this study offers a promising, natural, safe, and potentially effective alternative for tooth whitening, which may appeal to individuals seeking affordable and organic dental care options. For dental practitioners, the finding provides insight in the comparative whitening efficacy of natural fruit extracts versus the conventional bleaching agents, encouraging clinicians to consider and discuss natural alternatives with their patients. For the community, the findings can serve as a basis for oral health awareness campaigns promoting the use of fruit-based whitening agents. For the farmers and agricultural stakeholders, increased interest in green apple-derived dental products may boost demand for this variety, supporting local agriculture, encouraging sustainable farming practices, and contributing to economic growth. For the College of Dentistry, the study provides a foundation for future research projects exploring fruit-derived whitening agents, aligning with the institution's commitment to the sustainable and evidence-based dental innovation. For the Philippine Dental Association, they can use these findings to promote natural whitening in oral health campaigns and support research guidelines and continuing education on sustainable whitening options.